Now to an 11 Alive exclusive investigation connected to COVID-19. We uncovered explosive claims against a hospital accused of creating phony COVID-19 test results. Tonight, Reveal investigator Andy Parati follows up with the hospital about these accusations.
Your job as a nurse is to be your patient's advocate. We are their only voice.
A critical care facility accused of manipulating COVID-19 test results. The allegations made by 4 nurses in court documents filed against Landmark Hospital in Athens. One former and one current nurse agreed to tell us how the hospital allegedly does it. They've asked us not to identify them by face or name.
When they had somebody that turned out positive, they would redo the test so that it would come back negative, and they would say that it was a false positive.
Once our testing, the proper way, started coming back positive, we then weren't allowed to collect the samples any longer.
These nurses say the hospital instructed staff to take samples from inside someone's throat, but send them to a lab that only tests nasal swabs, knowing the results would turn out negative. When you raised red flags, what was their response?
They would deny it.
Deny, deny, deny.
This nurse says when she properly administered a test, her boss retaliated.
I did the test, and it did turn out positive, so I was terminated for not having a doctor's order for a test.
This is multiple staff members that were raising flags.
Natalie Woodward and Brian Cathy are attorneys representing the nurses. On Wednesday, they filed a temporary restraining order, pleading for a judge to step in.
The number one purpose is to have a court step in and take this over, have everyone tested appropriately, stop all discharges or transfers or admissions until the right procedure is done to figure out how widespread it is.
In a statement, Landmark Hospital CEO Marie Saylor wrote 11 Alive, "We can assure you that we will vigorously investigate allegations and defend our hospital and its staff against misleading and false claims. The hospital follows CDC, state, and local guidelines, as well as established protocols and procedures for COVID-19 testing."
You provide the
Multiple nurses still working there disagree.
You're lying to your patients, you're lying to the family members, and quite frankly, for a disease that has killed so many people, quit being so careless.
Landmark Hospital says it has no current COVID-19 patients it's aware of. Nurses tell me that's not true. A Georgia State University public health expert tells me that it is important to properly test patients to make sure the state has accurate case numbers. He says not doing it intentionally could be unethical and also dangerous. A judge could make a determination on whether to step in the next few days.